So the Transform study is a phase 3 randomized pivotal study that at its interim analysis last year showed a statistically significant improvement with regards to EFS, PFS in favor of Lisocabtagene Maraleucel over standard of care, which entailed salvage chemo followed by a transplant in patients with high-risk relapsed refractory large B-cell lymphoma. At this meeting, my colleague Dr. Jeremy Abramson presented the primary analysis of this study, now at a median follow-up of 17.5 months. We're very happy to report that the primary endpoint, which is event-free survival, the median EFS, is not reached in the Lisocabtagene arm versus only 2.5 months in the standard of care. With regards to key secondary endpoints, the median PFS is also not reached, and the median PFS on the standard of care arm is only 6 months. Important to highlight that there were no new toxicity signals that were seen. Important to underscore that there were absolutely no grade 4 or grade 5 cytokine release syndrome or neurological toxicity that was seen on the Lisocabtagene arm. With regards to further follow-up, the complete response rate deepened, with a few partial responses converting to complete responses at this time. There were no secondary toxicity signals that were seen at this median follow-up of 17.5 months. In addition to that, we also highlighted the importance of giving Lisocabtagene in the second line versus in the third line. As you're aware, on this study, crossover was permitted, and for the patients who received Lisocabtagene in the third line setting, meaning the patients who progressed on the standard of care arm and then were crossed over to getting liso-cel, their median EFS was way lower than patients who received it in the second line setting. Again, to underscore that it's really important that in this highest of the high-risk subsets of diffuse large cell lymphoma, it's absolutely important to get them to CAR T-cell therapy sooner than later.